rougher.
We have an old break in our splint bone.
Look at that.
It could be 20, it could be 30. I couldn't tell you. Okay, push her. We're running to go in there.
Ponytails Refuge is a full circle of life shelter founded in 2014. As a full circle of life shelter, we take in any horse, mule, donkey, or pony, no matter their age, size, breed, or training. Regardless of their background, we have never turned an animal in need away. Even after 10 years and over 1,100 animals that have come through our gates, you just never know what's going to happen. These are the horse rescue tales from the Tundra.
Okay, so Doug just arrived with the first 7 or 8 horses of the surrender event. Sorry about this. Snappy's got bad timing. He's gonna tell me he doesn't need to back up. Okay, so he's just gonna pull up a driveway a little bit. What did we end up with? 7, I think. All right. Hi guys, girls. So they all came from Duluth, Minnesota. They were at some sort of a kids ranch or something. I had to shut down. So we got the, they all got names on their halters. Awesome. Awesome. Winchester, love it. Okay. It looks like first coming off is Winchester.
It's Winchester, yep.
Yep. I'm glad he's got halters on him
Quick.
with names.
Oh.
Oh. You got him. Says, get me off this trailer. Who's this coming next?
Casey, is it?
Huh?
Casey?
Casey?
Yeah.
I'm guessing this is one with Cushing's?
I don't know. I didn't think so, but maybe.
All right. You got it, bud. Girl. Sorry. All right, Winchester and Casey can start settling in. What are we good? Looks like we got Walker next. Lots of chrome on this boy. All right, who we got coming now? Thunder. So Walker and Thunder headed in. All right, 3 more. Okay, this one here looks like her name is Annie. Maybe had a few babies in her lifetime. Come on, baby.
Can I take this one? It is
Annie.
Annie.
Yep. Come on, sweetie. You can fit. You got it.
I'll get you two.
You're gonna grab them both? Okay.
They were together, so they can do it.
Perfect.
Anna
Anna.
and Pepper or something like that, or is it? Peppy.
Anna and Peppy. So we've got an Annie and an Anna.
Yeah.
Okay.
Go.
Come on, girls. There we go. Good job. Good job. All right, that's the last of them for now.
So we just had a couple owner surrenders arrive. Their names are Zuri and Thunder, and we're gonna get them unloaded and get them up into the barn. All right, Miss Zuri, you're first. you go. All right, Thunder, you're next. Step. There you go, buddy. There you go. Yeah, she's right there. And now we'll get these guys up into the barn and in the stall and let them chill for the night. So today is the first day of our free low-cost surrender event. We just had 2 horses arrive. From the sounds of it, the first one coming off the trailer is handleable, but the second one, not so much. So we're gonna get backed up to the gate here and see how it goes. Well, hello. Ooh. Hey. All right, now we're gonna try and get this second one off.
Do you want to hold that door for her?
Good kid. Not bad.
A million times better than I thought it was going to.
We got this gate open.
Go with your friend.
Don't go that way. Yeah.
Here, I'll see if I can come grab the gate. Come on, honeys.
Come on, baby.
Good job. Good. All right, Jet. Good job. All right, Miss Star's coming out next. Yep. Step, honey. Good girl. Hello, hello. All right. There you kids go. All right, coming out next here, we've got Mr. Izzy.
Yeah, he's been a pasture pet, basically.
Yeah, just hanging out. That's all right.
So, the
Hey,
way you
bud.
sold him to me, you know, he's a fat boy.
Good boy. Oh, that wasn't nice, Star.
He needs to learn. You know, that's horses.
That's such a mare thing.
Yeah, it is a mare thing.
Yeah, I don't
Don't even look at me.
Gelding doesn't much mind.
No,
Yeah.
Gelding's like,
Jet
yeah,
says
where's the
whatever.
food?
Oh, it looks like he's blind in one eye, maybe?
Yeah, and I don't know how long that's been, to be honest.
Okay. It looks like
It's been
quite a while.
you know, that I can remember.
Okay.
We had horses years ago.
Thoroughbreds are hard to keep weight on generally anyway. You're all right, buddy. You got it. Just let him think about it. Watch he doesn't jump on you. Maybe give him more room. Ooh. That's all right. That works. You're okay. Scary truck coming by. Yeah, you can relax. His tongue is still just hanging out. Are you excited? You guys don't come out. Be nice. These two are kind of bullies. Hey, 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 hey. You're all right. You're okay. You're okay. I'll show you around.
Like 2 years ago. Okay. She's old lady. In Texas. Okay. And I got her to wear. Hey, watch it. Hey. No.
It is Sunday morning and we've got, I believe this is the 16th horse of the surrender event. Wade is on the road right now, picking up 4 more. We'll see how it goes. Oh, careful, baby. Careful. Does she have a Coggins or anything? He, she? She does have a Coggins? Let's put her in here. Because I don't want her getting pushed away from food. This one looks a little rougher. You're okay, sweet girl. Alright, Wade is just getting back. He's went and picked up the last 4 for this weekend. He had a long trip. He took off about 6 o'clock this morning, so in 3 stops. All right, here they come. Ooh, might want to hold the door. Come on, buddy. Go. Good boy.
I got
Gelding. Gelding, yep. All right. Oh, he's got shoes on too. Yep. All right, we'll get the other 2 off. From the last 2, these 2 apparently had foals this spring. Yeah, that's a cribbing collar, I believe. Ladies.
So first up we have Dela here. She's a recent owner return. They did bring her back. Their vet thought possibly some arthritis in the back and the lower limbs. What we've noticed is it looks like her stifle, I believe it's on the left side, is very swollen and catching. So we did take an x-ray of the stifle as well and her lower legs.
Here you go.
And she's not sound right now.
You want to walk her out? Yep. Walk her back for me?
The right one would be your
Yeah, I wasn't sure if it was the right or left.
Yeah, the right.
In my head.
Her right is, she's laying her right now. But you need the Colfax. Oh, girl. Stop there. Her hips look off. Like her right hip is lower than her left hip.
I can even see a little bit of drop looking at her from
Yeah.
this angle.
When you watch her move, her right hip is lower than her left hip, so it may be hip related. That's not bad though. I think their back's often sore when they're off just because they're favoring things.
And she's lost a little bit of weight since she's been gone.
It's got some short points, but not horrible. She's got chipped front teeth like has done some cribbing in the past. Her toes are long. Like she's got no
She
heel.
left here with shoes on because she had really bad bruising, but then they pulled them off and she's been doing fine.
She's got really dropped heels on the back. You can't help her. And long toes. Easy. Yeah, you're right about the stifle here. You missed it? Oh, easy. Yeah. I'd like to see her have a little more heel on her back.
We have the x-rays if you want to look at those too.
Is this the right?
Left.
This was one that wasn't really swollen, at least today. A little bit of inflammation in that one.
That's all right.
That one has a lot more inflammation in it. If you look at this one compared to that one, there's a lot less. That's flat right there. If you look right here, this bulges out. So there's for sure swelling in that joint. What's causing it, I don't see, distinct osteophytes. I don't see maybe a tiny bit right here on the back. Right there's a little calcification. Problem with stifle is you always wish you had more. Meaning I'd like to see that whole kneecap, which you can barely see. Yeah. The lower fetlocks.
Yeah. Give her fetlocks and her hocks too.
The lower legs on her do not look bad at all. Like I said, I feel like her fetlocks are slightly fallen, but I think it might be more her trim than her actual. Like just watching her, like her back end seems like the fetlocks may be a little bit low, but I think it's because we have a long toe and no heel.
No heel.
So you fix that, I don't think it's unfixable or that there's actually suspensory ligament issues. Scary looking chestnut.
Yeah. That thing does damage.
Which one is the right? Do you have any markers on that?
We should if you zoom up. This one's the right.
Yeah, that's what I figured because there's more inflammation here. But I think that inflammation might be more just descending from the stifle than the fact that it's actually in the hock itself. So yes, we have swelling in our hock. Did we sprain an MCL, an ACL, tear something? I don't see calcification, meaning it doesn't look like it's a chronic injury. To me, it looks like an acute twist, tear, injury. So it may get better, or if something's fully torn, it may not.
Okay.
But for sure, there's intercapsular swelling in the right stifle.
So just watch it.
That's what I would do, and you can do NSAIDs if she seems real sore. And then I'm worried about her hip. Maybe that's why her stifle's bothering her, because she's walking right on her hips. Because again, the one hip looks lower than the other, and I don't know if it's just because she's favoring the stifle or if the primary problem is in the hip. I couldn't get any response pushing on the hips. I couldn't seem to adjust them. Her back doesn't seem sore. I guess for me, I would say I'd put her on a gram of butadiene just to keep her comfortable, or Equiox, and just monitor her. If no improvement in a couple of weeks, you could recheck x-rays. Hopefully she improves, and everything looks soft tissue to me.
Should we put her on our Cairo list too?
You could. Her back doesn't seem that bad, but you could do the hips, see if you could adjust the hips.
Okay.
Because like I said, her back, not saying it's perfect, but really I didn't get much of a flinch when I went down her back at all.
So you don't really see anything for arthritis that...
No, like I said, it looks acute to me, meaning there's no arthritic changes really. You could say maybe a tiny bit right here. See right on the edge right there. If you compare that to this one, since we can't really. Looks a little cleaner. But in the joint itself, you could say maybe a little inflammatory changes right there. That's in the good one. And this one, you see that fluid line right there? There's more fluid in there, but I don't see. This surface seems really smooth. I don't see any chips off of it. Like, don't see any, chips out of the joint caps, at least from the views we have. I guess the only one you could do, which might give me more information, is if you did like a DP. So front to back to give a better view of both joints from a different angle. That'd be the only one more view, like a DP or an AP view.
Okay.
A DP instead of a lateral might of the stifle, because that's the only place I saw any changes within the right side.
Okay.
Right.
So we've got Miss Nadia in here today. We are going to try and sedate her to actually get a full vet evaluation done. Hopefully she's engulfed in her food enough to let us do a little poke and plunge. Oh my gosh. Shh. You're okay.
Spray out bent, but I think it went in. Did you see anything spray out?
I didn't see anything, though.
She's like,
What'd you do that for?
You definitely got it, guys.
Did you guys see it? Did you kill it?
I'm sorry, girl.
Ago he had pneumonia. Maybe it was even a month ago. And he's still just not well. He's coughing, but it's not.
Looks like he's put on a little weight, maybe.
He seemed to be doing better for a little bit, but now he's kind of coughing quite a bit and kind of uninterested in breathing and stuff again.
That don't sound real bad. You notice him breathing heavy or just off the feed?
Not really breathing heavy. He did have a little bit of snot last week. We took his temp and his temp's been normal and coughing here and there. It seemed like he was doing better after those first couple rounds of Exceed, and now this last week, 2 weeks, he's not doing so great again.
He's like so lethargic again.
Yeah, like this usually isn't him. Usually he's trying to bust out of the stall and get outside.
Feeling lymph nodes here. Say maybe a little bit enlarged on the right submandibular. His left felt normal though. Like 97.8.
Oh, quite normal.
98 now. So I really wouldn't call that much of a fever.
Right.
His lymph nodes aren't real big. His lungs don't sound real bad. Whew. It's not like it's crazy dirty. It's just swollen. Because I would wonder a couple things. Total protein, just to see if he has no diarrhea that you've seen.
No, some hoops.
Like I think his protein's off or something is off just with a swollen sheath. Or we could check for a white count, because I'm like, sometimes they don't run a temp and you could look, meaning you run a basic CBC chemistry and just say, what do we find? Because I don't really see anything obvious.
He is an older guy, so.
Yeah, I guess kind of your calls on that. With that swollen, he doesn't seem lame or anything, just lethargic.
Yeah, what are you doing? Every time you rub his back, he starts nibbling at me.
I think we should do some blood work.
I agree.
But at that, we'll let you know what we find.
All right.
So this is Thunder. He was one of the other Thunder. Most recent owner surrenders. He is an older guy. He cannot get hay back. He quids a lot and all of it falls out of his mouth. He's said to have arthritis in the back end, and she sent us with some Equiox for him.
He's off on his front. He's like clubbed. What would you guess? Pigeon? Pigeon-toed? Toed in, whatever the case. Hi. Can I feel your mouth, or are you going to say no?
Yeah, his feet don't look even at all.
Yeah. I think you could trim them, but they may be some. Oh, he's missing a lot of teeth. So mostly missing teeth on top, but we're missing like 208 is missing, and 109 and 10 is missing.
Okay.
And I don't know what else, but we're missing teeth.
Okay.
That's probably why we're dropping big old chunks of. You can float his teeth. He's just a titch right around 20. What did you have him as?
I think 33,
30?
yeah.
Really? Maybe? Really?
And this was the one the gal had most of her life, right?
Because looking at his, bottom teeth, his Gelvin groove, unless it's 20 and then it's 30 again, I guess I don't see that many 30-year-old horses. His Gelvin groove is just like touching the tip there like you would at 20. But back in. Maybe at 30, it's come up and then gone, regressed and come back again.
Okay.
I don't see many 30-year-old horses. I believe whatever she says, but. She's really sore right in the one birthday steak where they all get sore. Got some muscle loss along the back. Have any like fecal water or poops normal?
His poop's been normal? Yeah, normal poop.
Easy. Good for a 30-year-old of his color.
Yeah. Nothing too concerning back there.
I don't see anything back there that looks concerning. Yeah, I don't see any melanomas around his sheath either. Okay. He's got a little bit of a low body condition. But those teeth aren't going to help him. I would make sure you put him on some, especially being an Arab, make sure he's on the cool cal. You guys have that here.
We have weight gaining
Weight gaining supplements.
also mash.
And he's going to need mash because his teeth are. Even if you floated his teeth, they'd probably help make him comfortable, but they aren't going to help him from quitting and missing.
This is a Hackney.
Oh, I love Hackney. Do you know how to stand?
We got another one tomorrow.
Let's see.
So this is
Well,
Zuri.
You know how to stand? No, you don't. Well, if you lift up
She's a
Hackneys
Hackney.
and they've been in the show circuit, you lift them up like this, they put their legs out and they have that typical stance.
What's this one? She was said to have quite a few behavioral problems. She also has Cushing's. She did send her with medication for that.
What is she on right now?
Half a scoop of the Pergolide.
Your behavioral issue. You're a
A
Hackney.
little bit.
She came with Thunder.
No, I don't want a Hackney. They're cool looking horses.
Here, we'll bring her in the vet stock, Dave.
Okay.
Yeah, I guess we'll see.
You can look. Can I look? Yeah, thank you.
Her mouth is so cute.
She ain't real. She's got really nicely aligned teeth.
If she's on cell, make sure you get it.
I would believe it though. Dan could jump high.
I was gonna say these little Hackneys.
Yeah.
They're
Got
athletic.
legs, yeah.
They're the miniature horses with that are not vertically challenged. They're tied and they're all good.
Yep. I believe the lady said she had history of founder too.
I think that was prior to the getting the Cushing's and like developed.
Well, that would be my guess, because her feet don't look like she's foundered, meaning they look
No, not
rough.
right now.
But again, if we had Cushing's, that would explain it. Her goat looks like she could have Cushing's. You see that she's been fatter in her life.
Yeah, she said she really limited her hay intake and pasture and all that
Yeah.
stuff. And
She looks better now.
yeah.
You know how to pick your feet up? Thank you. I feel like neither of these horses were really worked hard or used a lot.
Not in recent
In recent years, yeah. I couldn't feel any missing teeth, at least as far as my finger went, which is like
Sounds good.
all right.
So the drugs did not completely take, and Nadia is still pretty aware of her surroundings. So Dave is going to poke her again, and hopefully we can get a lead rope on her and get her evaluations done. Are you itchy, Thunder? Yeah. Itchy, itchy, itchy boy. He's such a good boy.
This is Noki. You remember Angel Hair?
Yeah.
Misty? He is about a month older than her. He came at the same time as her. Yeah. He was adopted out he's been gone a couple years.
Hey.
And it wasn't until they started working him, she noticed him favoring his left hind.
Oh, it's all swollen up.
And we did take some x-rays.
Yeah, it's swollen.
I think he's 3.5.
You gotta be. Oh, look at him. They're so cute.
Little babies.
Oh, look at that one. So he's like 3. Yeah.
She
Why do you have ring bone at 3? Is he broke her eye then?
She was just starting to work with him when she noticed the lameness, so probably not.
It's really swollen in the fetlock down over there. Is that where you took x-rays of?
Yeah.
Just that. Good boy. Got good manners for a 3-year-old. Come teach my 4-month-old your manners. Yeah. So between the cannon bone and P2, that for sure seems narrowed. Did you take one of the right too?
Yeah.
Oh, see, that one looks good. Yeah, it'd be right here. So that's normal. His left, see how uneven that is? It's not, it's perfectly smooth. It's uneven, and there is some arthritis already starting right there. So he's gonna ultimately probably fuse that joint. So they're right about, I guess you could call it is ring bone. It just means this joint is not right. Meaning it's very little to no cartilage. It's starting to fuse already, has arthritis. But I don't really see the typical ring bone changes yet on the bones below and above it. Those haven't started because he's so young. So, joint supplements. If we can rebuild some of that cartilage, maybe we can get the swelling down and get them controlled. So, glucosamine, MSM, chondroitin sulfate, joint supplements, and then pain meds. But this joint is genetically crappy.
Didn't she mention something about she couldn't afford the surgery that they were talking about to correct it?
Yeah, there was something like that.
I don't know how you correct a joint.
Okay.
Do they have x-rays too? She had x-rays?
They didn't x-ray, the vet just looked and said that's ring bone.
Yeah.
So she brought it back. Talked about some surgery and she couldn't afford it, so.
Well, sometimes you can do a surgery to fuse the joint. So that's what they'll often do, is you can inject it with alcohol, you can put a plate across it. So basically, you put a metal plate across this joint, so basically speed the fusing process up. So I'm guessing that might be what she's talking about, because if you do that, then you have a sound horse. I always say there's 2 ways to do it. You let nature do it, work itself, but there can be a lot of pain and discomfort, or you just get a surgery, fuse it surgically. You can either, some people will screw across it, basically damage the joint to a point that it calcifies fast, or you put a plate across it. The problem with the plate is they don't always hold because horses are so strong and heavy. They have also done procedures where they inject basically alcohol, like caustic alcohol, into the joint to speed the process up.
Okay.
So instead of putting a steroid or an anti-inflammatory, you basically put something to make it inflamed, so you make it arthritic and you fuse the joint.
Okay.
So basically it's a method to fuse that joint so it doesn't. I'm more of a fan of trying to fix it than fuse it.
Yeah.
But I'm not going to say that joint is pretty, like I said, compared to this one, which actually looks really good. And I don't know why that one's so bad when the other one's so good, but like that's a normal looking joint. Then you look at this joint, and it's like right here, there's like this little divot. See that right there? It's not even smooth.
Alrighty.
One of the surrender vet ones, we just kept her over here because she's in such poor condition.
Okay, she's very thin and full muscly.
No, baby.
Age related, or you know?
Well, when they bought her, I think they said they bought her 3 years ago. The people told them she was 4. Their vet puts her at 18. She hates mouse touch.
She's neurologic. What's wrong with you, girl?
really takes her face touched.
Oh, look at those gums. So all those front incisors should be pulled. So she has, what's the disease called? I'm mind blanking.
EROTH.
Yeah, EROTH. See that gum recession and how bloody it is along the teeth line there? And then you have a draining fistula up here. That's why she hates her teeth being touched.
Poor kid.
I don't know, I'm sorry.
It's because those front teeth hurt her. Yeah, so her points aren't bad, but those front teeth, that's not good, meaning she needs probably extractions. I'm just really worried about her back end here, though.
She's just so weak.
She is weak.
God, no.
She's not functioning right. I don't think it's just anorexia. There's something neurologic with her. Just think if she has proprioception here. Yeah, in the front she does. Basically, I'm looking with a lot of neurologic horses, when they put their foot down, they won't put it down flat because they don't know which is flat. So they put weight on it.
I remember the dad saying something that she was. Was that a different horse? It was like off in the one back leg. I can't remember.
To me, it's like the left half is bigger than the other two.
This one here, yeah.
Yeah.
Because when I picked up her right, she was a lot less stable.
I'm talking about in the front here.
Oh.
From this side, it looks like it's bulging out on this side.
The what?
This one?
Yeah.
It might be a little bigger.
Oh, I see what you're saying.
Yeah, it does not look the
Come
same
look at
size
it.
at all.
Over here. Like right there. Unless it's just there. It's dark there.
In the front there.
Yeah, I see.
That's the least of our issues.
Yeah.
What it comes down to me is she needs significant dental care, and in Wisconsin, she's not going to survive the winter in her present condition. So she would have to go to an indoor heated stable or get moved down south, in my opinion. She just doesn't have enough body fat weight. And even if you took her teeth out, I don't know if you'd put it on in time. If she's outdoors, she's going to go down. Meaning slippery, snow, poor body condition. I don't like to be negative, but I don't think there's a good prognosis. To me, there still seems something neurologically wrong.
Do you think that's adjusting her teeth or?
Well, that's what I know. That's what I don't know. Like, to me, I was trying to move her head to see if she's like wobblers type thing. Like, to me, she still seems neurologically wrong. Or maybe her teeth are that bad and she's lost that much weight, she's just weak and sore. But her teeth really hurt her. Well, she's got a draining tract. She's got a bunch of painful issues.
They had said that she had an infection in her mouth that cleared up.
It's never going to clear up because she's got her body's destroying her teeth. Work. I don't think she's a bad horse. I think she's just painful on her front face, and she says, "Don't touch my face." Even when I ran my finger to the back, she didn't care. It was when you touched the front of her teeth.
We are attempting to move Miss Nadia now that she is fully sedated and we have a couple leads on her to the vet stock. She is not used to leading or giving to pressure, so we will see how all this goes.
Come on. Come on. Get out of there.
Good girl.
Come on. Come on. I want to just try to get him. You just gotta get him.
Good girl.
Good girl. Okay. Oh, in the front. Push her in. Okay, push her. We want her to go in there. Don't touch her. Just
Easy, man.
Easy, girl. Not your fault. Is that pickle?
Yeah. At the drugstore again.
You go that way, girl? Easy, girl. You're okay. Go that way. Easy. Come on. Easy. Stand there. Let me see.
Wrong way, baby. Easy girl.
Hey, back here. Hey, girl.
Easy girl.
She's one that's more of a jump.
We did it!
Yay! She can't see you on that side. You're okay.
Because then she'll freak out.
I don't know either.
I'm going to give her another dose of sedation IV, I'm hoping.
I would hope so.
Hey, girl.
Just be prepared for her to come this
You
way.
can touch her neck without her freaking out.
She's super soft. She's a lot more comfortable with me on her left side. I don't know if that will make a difference. Is that fun?
You can't go backwards. If she goes up, try to pull her down. Easy. Let me touch you. You're okay. Good girl.
No. Absolutely not.
Easy.
No. Nadia.
Easy. You gotta touch your shoulder. Easy.
Cindy said she did better on the left side. I don't know if I'm gonna try that side.
No, I could try.
Yeah.
I just thought she was blind. Maybe
Yeah.
blind is better.
I don't know.
Some horses freak out when you touch them when they're blind. Some horses are better.
Maybe just talk to her again.
All right, I'm over here. I'm right here.
At least you can't see the needle then.
Right.
Easy. There you go. Good girl. Easy. Easy.
You're okay, girl.
You're okay.
What's he doing? Well, the dog was barking at him, and he just started to jump his own mortgage, and the dog started to watch us.
Good job, girl.
Yeah, but look the age of, so 3?
You think about 3?
Little one.
Easy. But look at, they're all in wear, but they're all baby.
Cute little teeth.
They almost two, the last ones come in, but they're all in wear, so yeah, it's might be even 2.5.
Okay.
You're just a youngin'.
Cool beans.
I'm guessing she's fairly long bred. Probably bred this spring, was that? Or you have no clue. When did you get her?
We got her in the summer, right?
Yeah, I want to say
June.
Oh, I was gonna say
It was during
May.
the Olympics. Olympic names, so July. When were the Olympics?
I don't know.
One of those two.
June or
ones.
July?
So we're like over maybe bred this spring then.
Definitely, potentially, yeah. Or maybe not at all.
Here's first.
You distract her up front. I don't know how you distract her.
Yeah, I was gonna say.
Really not reacting.
No.
I hate roach beans, but I really kind of want to roach yours.
I know.
Oh, there's a big baby in here.
Oh no.
He is bred 100%.
That was a very fast response.
Well, I'm meaning big by, it might be, let me get a better look. I can feel it if I just put my hand in.
Oh my.
It has hooves.
Makes sense why you're gaining weight all of a sudden.
And all right.
Yeah.
Yeah.
Oh, she is.
Very much so.
Yeah, she's got a baby inside of her. Looks healthy.
Daily project.
Yeah. No kidding.
Yeah, she is. Baby looks great. I would put her at 150. She's 5-ish months along. 5, maybe 6 almost.
Got us through winter at least. Early
So
spring.
we got 3 months till it's due, 3 to 4. So that would put you in March due date,
Well, 11 months.
February,
And you thought she was
or
5 or
12.
6?
You're right, 6. I'm doing cow math.
Yeah, I was like, wait a second.
I'm doing cow math, my bad. So let's say 11, and she's 6. I'm just gonna say on the long, it'd be like 6.
So I'll be ready by March probably.
She would probably bred May-ish. So let's say her bred date was May 1st, just to try to make it math easy. That
Right
means it
before
would
we
be
got
due April,
March, April.
March, April. I always find it hard at this rate because the foal's about this big, but I don't know what she was bred to.
Oh, yeah. Like a horror show.
But she doesn't look, she looks bored.
No. She moves.
Dandy.
She moves like a Dutchman horse. Yeah.
She's just so short, I guess she's still probably hardly growing.
Yeah. And especially now that she's pregnant and has no nutrition, she came to us super thin. So I'm surprised the baby's doing so well.
Mm-hmm.
Thankfully the baby's doing well, but surprised.
Heart's good with flow, but that's because we drink. Heart sounds good. Your lungs sound good.
This is faster.
Hey.
We're gonna have Dave sedate him and then try to see if we can feel both testicles. And if we do, we might be losing the boy berries today.
Hi, Fester.
It ain't that bad.
It ain't that bad. Touching their head is worse. Which is where we always go to on a horse. Because no one likes to go behind a horse.
Ooh. I'm gonna say he's relaxed.
Oh, you had a good time, huh? Got one on this side. He's cute. He's got a pair.
He's got both?
I feel another one here. Yeah, one just is up there a ways.
Okay. Okay.
He's got one is like a really small one.
Okay.
Size doesn't matter.
What do you think?
I think we try to lay him down and
Take
bake
him
them.
Cool beans. All right, dude. Time to lose the boy berries.
They're the good stuff, bud. So that one's small. I'm hoping it doesn't escape us once I lay him down, but
Get sucked back up.
yeah, hopefully the ace does its trick and keeps it down. The one on this side, so his left is normal. Right one's very small. But we'll find out.
So what do you do if it does suck up?
Well, I'll try to find it. I don't cut it till I can feel it. So.
Gotcha.
Can't really do the cow thing where you cut open the one you can find and then kind of use that hole to look a little bit.
Well, you can to a point. That's a whole more major procedure than I'm prepared for right this minute.
Yeah. That doesn't sound fun.
Okay, shoulder length.
He's like crossing his legs like, no, don't do it.
You don't even know you're missing him. You're still a baby.
Right.
Look at all the girls laughing. All right. You want to manhandle him? You want to take my string? Perfect. All right. Cool. You're going to come here and put your knees on the neck. Just here. You can just put all your weight.
Got it.
Tries to get up, just stay on the neck. If the head stays down, horse can't get up.
Okay.
You're not that heavy. You're not going to hurt it. I'm heavier than you are. So. Maybe. I guess I shouldn't assume things. All right. You going to hold the leg then?
I can.
Perfect. This is, see that little right there? One. Grab some lidocaine and do some blocking. That one's easy to find. Now, where's the other bugger? I know I felt it. That one's good.
Is that iodine?
Yeah. You open this up now. I just don't want to lose the nut I found. Perfect. Can you do me a favor now and go grab me my tool sitting over on the bed, on the logs over there? All right. Thank you. One testicle. That's a little one. He's a pretty good boy. I know. That's why I was like, that's the one I couldn't feel before because it was so small.
Who else do we have after him, buddy?
Buddy.
Done. Beautiful. All right. I'm gonna go wash my hands and then we're gonna look at Buddy.
He's supposed to be an off the track thoroughbred. We looked, we do not see a tattoo. It's supposed to be roughly in his 20s, but you'll see
Good.
I almost think there is tying there, but you can't. Yeah, I don't see it. Oh, talk about cribber, huh? You wear those right off.
The guy that brought him, he belonged with dad. His dad's in hospice, and so he didn't know a whole lot.
He's got chunks of food in there. He's packing it in. He's missing a tooth or two. I think I felt one missing on that side. Tooth missing in the 200 quadrant. He could be 20, he could be 30. I couldn't tell you. Looking at him, I'd say closer to 30 than 20, but that'd be my speculation. Man, those feet almost look more standy to me than thorough. But
I think the guy said he had bought him from an auction when Barron was still doing horse auctions.
Oh, okay.
A while ago. Yeah.
You've got some big feet on you. Well, maybe they're just not trimmed very well. Eh? Any tattoo there?
I don't think so.
I don't see one there, so that seems standy. It might be a thorough. I don't know. They think standys tend to have a little bigger feet than thorough sometimes, but it might be just they're not trimmed. Got some arthritis. A lot of arthritis. Can't even fully flex that. Easy, easy. Crack, crack, crack. Hopefully your teeth look better than his at least. Here. Hey. Hey. Come on. Oh. That's nice. Sore. It's like an old rusty wheel. Sore through his withers. Got to sway back, which you can all notice. A little sore right there too, like I would have expected. Just kind of an old boy.
Probably not the best outlook for him.
Well, not really. Those teeth are going to be hard to be honest with you. He's lacking muscling. He's just, I think, old. He needs farrier work, he needs teeth work, he needs chiro work, and you probably ain't going to fix anything. You might just increase quality of life for a period of time, maybe.
Maybe.
He doesn't look to me like he's a horse that's going to probably could fall over and die this winter. He might make it, meaning he's not like he's sway back, but he's still got a little bit of fat over his ribs, not a lot. But he's also a thoroughbred. They never are that heavy, so. You know, he's still pretty stable on his back end. Like I pushed his back end and he responds and he's stable. But he's very arthritic.
Mm-hmm.
So he could go down or he could make it. I don't know. I would say not great.
We kind of subscribe to the better one day early than one day late.
Well, I would say not great. Better than hers.
Yes, absolutely.
Old, lean horse.
With no front teeth.
With no front teeth. So grazing probably is an easy form.
So here we have Taylor's. She was at camp, quarter horse that we thought might have navicular. Polly looked at her feet and he thought maybe in the right, but he didn't put shoes on. He was going to try and just take her toe back some and see if that helped.
Didn't get far enough down to see navicular.
No, we weren't looking for navicular because he wasn't entirely, didn't really think it was. We went higher up to see if there was anything else that could be.
This might look good, at least from this angle. For sure a bit of swelling in our suspensories on whatever leg this is. This right? I don't see a marking on it.
I don't either. But it is the right.
Right. So if you look at this one compared to this one,
Yeah.
There's some swelling like right here.
Yep.
That'd be your superficial suspensory ligament, which could be linked to navicular.
Okay.
Because again, the navicular runs that's where it would attach. Well, the deep would is not superficial, but it's kind of in between the two.
And he did say if he was gonna suspect navicular, it would be in the right foot. So.
Yeah, and the right looks off to me, not bone-wise, but in the soft tissue right here in the suspensory.
Okay.
But when I see suspensory, I say one of two things. Could be, are we thoroughbred or what breed?
Quarter horse.
Quarter horse. It could be, again, interesting. We have an old break in our
Oh
splint
yeah,
bone.
look at that.
So that splint bone fracture could be what's causing inflammation there too. So that's an old fracture, but I don't know how old.
Sure.
So that is an interesting note. I don't know. Most of the time with splint bone fractures, they can cause issues because, like you see, sometimes they'll get closer and they'll actually start rubbing on the other bones. One of my vets had a splint bone fracture on her horse, and I didn't do it, but they took her up to Stillwater and they surgically removed the tip of the bone because splint bones aren't really that important. It's more important to have a little loose piece of bone there is more bothersome. Which you can see, like the suspensory ligaments running along it, and if you're putting weight on it, it could be moving this bone every time they move.
Okay.
So that might be the basis of our issues right there.
Okay.
Not saying it couldn't be navicular as well, because we are quarter horse.
And
again, it's going to be bothering the suspensory ligament, which is going to have a very similar presentation. So that's what I'd be a little bit worried about, which again, repair could be just time, or, like I said, if it were performance horses, they generally will go in and remove that tip of bone that's been fractured.
Okay.
He fractured her splint bone.
Who's that, Taylor?
Taylor, in her right, which is the one Polly thought she had.
And there's a lot of inflammation around it. I noticed inflammation, and then I look close and I'm like, oh, the split bones.
So what are we thinking there?
Well, time can heal and it can calcify and it can stabilize. If it stabilizes, to me it doesn't look completely stabilized, like right there.
No.
The other option, like I said, like Dr. Amy, one of our vets, I found one of their performance horses injured its splint bone just similar to this. We caught it acutely because it happened after all of a sudden it quit being able to perform, slowed up and got lame. Went in and surgically removed it and the thing's sound again, but that's like a Stillwater thing, and I don't know if this is a performance horse expectations. It could get sound, but I don't know. Depends if this is able to stabilize.
Do you have a rough guess how long ago that maybe happened?
To me, it's calcifying. I would say 8 to 12 weeks ago, maybe. It's not recent.
Okay.
Meaning it's already calcifying around it. It's not a fresh break. Maybe 6 to 8, I'd say, but it's not. It's months, not weeks. Just to get that much of bone regrowth already, you can see there is bone regrowth around it.
Stall rest, or what do you?
Generally, they do put them on stall rest if they tolerate it. Meaning it can help it, if she's not moving as much, it can help this kind of calcify in a little quicker and easier. But again, there's no weight bearing in this splint bone. Like I said, they're kind of, some people call them evolutionary residuals, meaning we don't know why they still exist there. We don't really need them.
To cause problems.
And some horses have no splint bone, meaning their splint bone, you won't even catch it in this view. While some horses have really long splint bone where it almost runs down to the sesamoids.
You mean that she's already in her 20s?
If it was me, I'd say maybe some stall rest, at least to make it so she's not being pushed around. She's in a smaller area, not having to move a lot, and see if it improves with rest.
How long?
You don't really cast them.
How long are you thinking?
I wish I knew when it happened.
Yeah, I know.
Maybe this is 10 years ago and this is an old residual injury that's flaring up again, and stall rest isn't going to make a difference. Like I said, it could be 6 to 8 weeks, it could be years, meaning it never healed.
If it was most recent, how long would you think she'd need to be in for?
Generally, I like them to be on stall rest for about 12 weeks. So another, if it happened 6 weeks ago, another 6 weeks. But again, I don't know if it's going to improve after 6 weeks of stall rest, and a little bit temperament of the horse. Some horses, you put them in a stall and they're moving more and they're worse than if they're out on with their buddies.
We just took the 2 shots of the stifles from Miss Gucci.
More inflammation in his right than his left. Is he sorer in one than the other? Said there's greater changes in the right. So basically what I'm looking at here is intercapsular right here, the swelling compared to here. So you can see this extends out beyond, like you can see it extends out to here, the capsule. Here the capsule ends right there. That's normal. This is inflamed. Now, I always say inflammation in the bursa, what does that mean? It can mean something's damaged. It can mean that it's being overused, meaning a bursitis, basically an inflammation in the bursa, secondary to overuse, which I do see with horses. You know, I had a chronic horse with laminitis, and then it started to have fallen fetlocks and like issues on its back end because it's always taking its weight off its front. And that's really a common prognosis, because you tend to get your fetlocks and your stifles get worse on horses with laminitis in the front because they're compensated. They're doing compensatory work.
So if we get the front feet under control, is that something that...
It could be reversed, or it may be a continuing issue in the back end too, because it's wear and tear from being not controlled on the front.
And she's how old?
I think she's like 16.
So that gives me a better prognosis. As long as she remains lean. Is she heavier?
She's chunkier.
She's a pretty good weight right
but
now.
she's not like...
Yeah, you know, my guess is, especially with laminitis issues, she probably was really heavy.
Yeah.
And, you know, that's going to be a problem if we're overweight.
All right.
So, nothing here that I'd say, oh, dooms her, but it's another thing to work with along with the laminitis. It might be correlated.
So you think Equiox?
I would say Equiox and some sort of, you know, chronic inflammation treatment. And, you know, never hurts to do a joint supplement. I know I say that a lot, but it doesn't hurt and it often helps.
Okay.